Good morning, everybody. We are going to go ahead and get started with today's webinar. My name is Molly Dino, and I'm the project coordinator for the California Evidence-Based Clearinghouse, or the CEBC for short. I'd like to thank you all for joining us and welcome you to the webinar. We've muted your phones due to the high number of participants attending, so if you're experiencing any technical difficulties or have any urgent questions, please use the Q&A pod located at the bottom of the screen in front of you, and we'll do our best to assist you. We will also answer questions after the completion of the webinar. Please also find the PDFs of the webinar PowerPoint slides and other webinar relevant materials in the bottom left corner of the screen in front of you. Lastly, you will receive an email with a link to after the conclusion of this webinar to complete a short and easy survey so we can continue to improve our webinars and make them as useful and beneficial as possible in the future. So now I will give a brief introduction of our presenter. Jared Martin is the Research Associate with the Chadwick Center for Children and Families at Rady Children's Hospital, San Diego. Jared's primary role is to support the CEBC's work on promoting guidance and resources on the implementation of evidence-based practices, which includes conducting trainings and webinars on implementation topics, providing technical assistance, and keeping the CEBC selection and implementation website up to date with research and new content. And now I will go ahead and turn it over to Jared Martin.
Great. Thank you for the introduction, Molly, and hello, everyone. Thanks for joining the webinar. I do want to point out that today's webinar is 60 minutes, which is a little bit shorter than usual. Our typical webinars are 90 minutes, but that said, we do have quite a bit of content to get into, so we are going to be saving questions for the very end. So we do have a chat box feature where you can type your questions into. You can do that at any point during the presentation, but I won't be getting to them until the very end after the content portion. Okay, so just to review our learning objectives, really the focus of this webinar is to provide you with an understanding of how the CEBC can help your agency or your system with addressing some of the continuum of care reform core service areas. And so we'll be focusing on how you can identify new programs and access information on those programs. We're going to be specifically looking at trauma-informed care, home-based mental health care, residential therapeutic programs, and then also child and family teaming approaches. There's an important caveat that I want to point out, that the programs that we're highlighting on this webinar are not endorsed by the CEBC and are not guaranteed to obtain the mental health program approval through the California Department of Healthcare Services for the STRTPs, which is the short-term residential treatment programs. We'll talk a little bit more about that later. But those are standards that are set by California Community Care Licensing. So be sure to reach out to those individuals, whether they're within your county or within the state, before you make any decisions to adopt a specific program. And again, the programs that we're highlighting are programs that could potentially meet the needs that are being addressed by continuum of care reform. And then we're going to be talking about, we're going to be showcasing some tools and resources for implementing EBPs that address CCR core services. And then finally, we're going to be talking about cross-system collaboration, specifically between child welfare and behavioral health, and what are some of the best practices and strategies for going about cross-system collaboration. Okay, so we have a series of poll questions throughout the webinar. The first is, what is your service system, or what service system do you work in? So you can see the responses are A, child welfare, B, mental health, C, juvenile justice, D, housing, or E, other, which could be academia, policy, research, etc. So if you want to take a second to pick the option that fits closest to what you do, and then we'll broadcast the results. All right, go ahead and close the poll. I know we're going to be moving quick. I still see some responses, but is there a way to broadcast the results?
Yeah, they were. were on there.
Oh, okay. So it looks like the majority of the folks were child welfare, followed by other, which could include academia, policy, research, etc. All right, and then second poll question is, what is your position type? We have direct service, supervisor manager, administrative support, and director, organizational leader, or other. If you want to take a second to let us know, who are you? All right, so it looks like most of you are directors, organizational leaders, which is great. That's ideally who this information is for. So we're going to go ahead and move on now. All right, so we're assuming that most of the folks on the line are aware of what continuum of care reform is. We're not going to be spending a ton of time on that, but just for kind of the flow of the webinar, giving you a sense of what we're highlighting and why it makes sense, we do want to talk about what CCR is. So really quickly, it's a series of new and existing reforms to child welfare, also known as AB 403, provides the statutory and policy framework to ensure services and supports provided to the child or youth and his or her family are tailored toward the ultimate goal of maintaining a stable, permanent family. So there's some guiding principles that are in place for informing CCR efforts. The first is all children deserve to live with a committed, nurturing, and permanent family that prepares youth for a successful transition into adulthood. The child, youth, or family's experience, along with voice, is important in assessment, placement, and service planning. Children should not have to change placements to get the services and supports that they need. Also, agencies serving children and youth, including child welfare, probation, mental health, education, and other community service providers, need to collaborate effectively to surround the child and family with needed services, resources, and supports rather than requiring a child, youth, and caregiver to navigate multiple service systems. And then finally, the goal for all children in foster care is normalcy in development while establishing permanent lifelong family relationships. Therefore, children should not remain in a group living environment for long periods of time. So these are the specific reform efforts within Continuum of Care Reform. The first is the approved relative caregiver program, which participating counties support relative caregivers with a payment equal to the basic foster care rate. The second is the Resource Family Approval Program. So this is the new name for caregivers in a family-based setting, including foster families, relative caregivers, adoptive families, and guardian families. So RFAs provide upfront training and assessment for families seeking to parent children in foster care. Then there's the Quality Parenting Initiative, which are new strategies and practices within child welfare for the recruitment and retention of quality caregivers and support biological parents with reunification efforts. Child and family teaming. So CFTs are a group of individuals that engage with the child or youth and their family in assessing, planning, and delivering services for that child. CFTs recognize that a team approach to case planning and care delivery is critical to effective care for all children and youth in foster care. Pathways to mental health, that originated from the KDA settlement, and Pathways aims for children in foster care to receive necessary mental health services that they are entitled to under Medi-Cal, and that those services are available in family settings. And then finally, residential-based service reform. So group home placements transition into short-term residential therapeutic programs. I've also seen them called residential therapeutic centers. And they include ongoing community-based services and support. STRTPs are a residential facility that provide integrated programs of specialized and intensive care, supervision, services and support, and treatment for children. So that's really the extent of the information that I'm going to go over on CCR on the policy level. If you're interested in learning more, here's a series of links to other resources, including the California Department of Social Services, CalSWEC, the California Institute for Behavioral Health Solutions, has some great training resources on STRTPs. And then the Alliance for Children's Rights has an implementation sandbox where they feature a lot of Q&A questions around the RFA approval process. All right, so really getting into the meat of the webinar is using the CEBC to identify new core service programs. So we have another poll question to get a sense of how familiar are folks with the CEBC. You can see on your screen responses are A, extensive, A, very familiar, extensive use of the site, resources, maybe you've been on multiple webinars. B, moderately familiar, maybe you visited the site once or participated in one webinar. Slightly familiar, you've only heard of us. And D, you've never heard of us. So I want to take a second to select the best fit. All right, so it looks like all of you responded, and the majority is you're moderately familiar, so you visited the site and participated in a webinar, which is great. So I'm going to introduce the CEBC for those that aren't too familiar with it. I'm not going to go into a ton of depth. There are other webinars that we've recorded and posted on the website that you can access to learn more about us. Specifically when I get to aspects of the CEBC like our rating scale, which can get pretty complicated, or not complicated, but in depth. I'm not going to go into as much depth. So basic information about the CEBC, we're funded by the Office of Child Abuse Prevention within the California Department of Social Services, and we're operated by the Chadwick Center for Children and Families at Rady Children's Hospital. And our mission is to advance the effective implementation of evidence-based practices for children and families involved with the child welfare system. And we do that through two methods. First, we have a program registry on our website where we provide information on practices with varying levels of research evidence, and we rate those practices based off of their peer-reviewed research evidence. And then we also have on our website the Selecting and Implementing Programs section, which is relatively new, and it has information and resources on there on how individuals and organizations can go about adopting an evidence-based program and implementing it with fidelity. So this is the front page of our website. This is a screenshot for those of you who haven't been visited before. And you can see you can access the program registry on the left-hand side and the selection and implementation resources. And so this is a relatively recent update to our website, and we're continually in a continual process making revisions to improve it and make it a little more streamlined and user-friendly. So keep an eye out for changes to the website. Just really briefly, I want to touch on how the CEBC defines evidence-based practices. We're looking at programs that you, within your agency, can replicate because there's a manual or that there's training that you can access to be able to run that program, and that your organization needs to implement that program with model fidelity in order to achieve the same results that were found within the peer-reviewed research. So this is an important distinction because when we get to aspects of continuum of care reform like teaming and CFTs, that can be viewed as more of a process approach or a strategy. And so when we get to really discrete programs on how you can implement teaming approaches, it's a little bit different. So it'll make more sense when I get into the CFT topic, but for the purposes of moving forward, we're talking about programs that need to be replicated with model fidelity, so they're discrete programs. And so part of the CEBC's mission is to provide a quick and easy way for folks who aren't buried in the research, a method for understanding that research. And so our scientific rating scale is one way that you can be in the know about how effective a practice is without combing through all the peer-reviewed literature. And so I'm not going to go into a ton of depth about our rating scale, but I'm just going to provide a brief overview, and if you're interested in learning more, you can go on our website to read more about it or watch our previous webinars. And one of your handouts in the files there is an overview of our scientific rating scale, so if you want to follow along through that handout, you can do so. But really quickly, so you can see that the scale goes from 1 to 5, and so 1s are well supported by research evidence, and those are programs that have what are called randomized controlled trials. And so to be rated a 1, a program has to have at least 2 published randomized controlled trials, which are the gold standard for understanding the cause and effect for a program. And in order to be a 1, not only do you have to have 2 RCTs, you also have to have a 1-year follow-up showing a sustained effect of the program. So that's what it takes to get to a 1. I mean, there's more to it, so definitely make sure you check out the website if you're interested in that aspect of it, but that's really one of the key differences. So a program rated a 2 is supported by research evidence, and those are programs that have at least 1 randomized controlled trial showing at least doing a 6-month follow-up showing a positive effect. So that's the key difference between a 1 and a 2 is the number of RCTs and the length of the follow-up. A program rated a 3 is promising research evidence, and those are programs that have a pre-post showing positive gains. So participants in the program were assessed before they went into the program and then after they completed the program. And then there's also a control group comparing those outcomes. And so the control group can include a wait list, so folks that did not receive the treatment, or treatment as usual, or some other treatment that you can compare to. 4s are programs that research has found that there is no effect, and then 5s are programs that have research that shows that there is a concerning effect, so either some sort of negative outcome, or that there's some sort of legal precedent that's made showing that the practice is not safe to be used. So we don't necessarily require research for a program to be a 5, but just know that we currently do not have programs on our website that are rated a 5. And then we have finally programs that are rated NR, which stands for not able to be rated. And these include programs that have no research evidence, or that they have research but it doesn't fit within our rating scale. So the reason why we have NRs is to provide truth in advertising. So if you're interested in a particular program that's claiming to be evidence-based, you can go on our website and be able to search for that program and identify whether or not it does have research evidence. And so these are programs that are pretty broad in nature. So they could include programs that have research, and it could be good research, but it's possible that they don't have research that's published in a peer-reviewed journal. But because we have that peer-reviewed standard, we're unable to rate it. So even a program with good research could receive an NR. And so that's what I mean by NRs are pretty broad in nature. So make sure that when you're looking at programs that you don't outrule an NR just because it is an NR. Make sure you look at the research and reference section on our website, which I'm going to show you shortly. Okay, so that's about as much depth I'm going to get into the rating scale. Again, if you're interested in learning more, access our website. So we have another poll question. So which CCR core service area is your system or agency primarily interested in addressing? You can see A is short-term residential treatment programs, B, resource family recruitment and support, C, home-based mental health care, D, child and family teaming, or E, all of the above. So you want to take a second and let us know what you're most interested in. Okay, let's go ahead and broadcast the results. It looks like the majority of you, by a lot, are interested in everything. You want it all, which we will be touching on a little bit of everything. Just so you know, we're not going to go into a ton of depth just because there is so much information available on our website that even if we were to make this webinar even longer than 60 minutes, there is a lot of information on our website that is pretty much all relevant to continuum of care reform. So just keep that in mind. But we will be touching on all of these areas right now. We'll go and close the poll. So we're going to start with short-term residential treatment programs or centers. So this is a list of topic areas that we have on our website, and I'll show you how you can access the topic areas in just a second. But these are topic areas that we organize programs by on our website, and so here are some topic areas that could be of some interest to STRTPs. So these are just a few. Like I said, there's a great deal of information on our website, and a lot of it is relevant to STRTPs. But you can see behavioral health programs, mental health programs, and supportive services. I'm only going to highlight a few of these as examples, but the process that I used or that I show you on how to access information on these topic areas, you can apply to any other area. So it's transferable knowledge, and it's all organized similarly on our website. So I'm going to be talking about higher level placement programs, substance abuse treatments, and then that other area, red arrow should be pointing at trauma treatments. It looks like it's pointing at depression, but I'm not going to be talking about depression. So this is a screenshot of our program registry. So you can access programs a couple different ways, or you can search for programs a couple different ways. The first is you can search by a list of program names. So it'll provide you with every single program on our website in alphabetical order. Or you can search with filters, and so that's our advanced search feature, and you can search by the age range of the population that you're working with, by the rating of the program. There's a couple different filters on there. So that's one way. Another way is that you can search by the specific name of the program by typing it into the gray area there. And lastly, there's the topic area button up at the top there, which is what I'm going to be showing you right now. So topic areas are clustered into broader domains, and this is a list of our broad domains. You can see anger management, domestic violence, substance abuse, behavior management, including parent training, core child welfare services, including placement and reunification, engagement and parent partnering programs, mental health programs, prevention and early intervention, and support services for youth and child welfare system. So these are all drop-down fields. So if you were to click on one of those broader domains, so I'm going to click on core child welfare services. When you click on that, it drops down all the list of topic areas that fall within that domain. So you can see casework practices, child welfare, workforce development and support programs, family stabilization, higher levels of placement, kinship care, permanency enhancement for adolescents, placement stabilization, post-permanency services, reducing racial disparity in child welfare, resource parent recruitment and training, reunification, supervised visitation, and working with parents with cognitive disabilities. So as I mentioned, we're going to be highlighting the higher level of placement area. Are folks saying that they can't see the screen?
No, just one person. I'm working with them.
Okay. Okay, well, hopefully you could see that now. Those were screen cap images of our website, so it's possible maybe they didn't transfer over into Adobe Connect. But hopefully you can see the PowerPoint slides now. So if you were to click on higher levels of placement, you would get a description of what, how we define those programs. So when we talk about high levels of placement, CEBC defines those as as group residential or community treatment facilities in the California area with a rating classification level of 12 and above. So we have several programs in that area, so it looks like we have 10 total. I'm only showing, looks like 4 of those because those are the programs that can be implemented within residential care facilities. There are other programs that are high-level placement that are more treatment foster care based, so that they are programs that you would deliver in the home, a home-based setting. These because we're talking about STRTPs, I'm just highlighting ones that are implemented within residential fields. And I also, another important note is I'm not highlighting any of the programs in the that are rated NR. So these are just programs that have a rating. I'm not going to go into describing every single program that we're talking about, just because it's in the interest of time. It's better to just talk about how you can access this information, and to get a sense of what's out there. But I do want to show you an example of, okay, so if you were interested in one of these programs, what types of information is available. So I'm going to highlight Phoenix House Academy as an example. So this is another screenshot of our website. And so if you were to click on Phoenix House Academy, you'd get a description of the program and quite a bit more information. And so you should be able to see up at the top its rating, so it's rated a 3. And then right next to that is our child welfare systems relevance level. I'm not going to get into a ton of detail about that, but that's a level that is determined by examining the goals of the program, the target population for which the program was developed, and any research that's been conducted for the program to determine its relevance for children and families served by the child welfare system. So the relevance level is not a rating, and you shouldn't use it to exclude programs from consideration. But programs that are determined to have a level of medium or low may still be useful to child welfare agencies, so don't outroll it just if it is a low. So kind of looking, scrolling down, you can see that the target population for Phoenix House Academy is for adolescents ages 13 to 18. And if it provides services to parents or caregivers, it would list the age range there, but it's for 13 to 18-year-olds. And then it gives you a brief description. So Phoenix House is a residential treatment program for adolescents ages 13 to 18 with substance use and co-occurring mental health disorders. It employs a modified therapeutic community specifically geared to the developmental and treatment needs of adolescents. And you can keep reading on. If you were to scroll down, you get a list of the essential components of the program. And so, essential components for Phoenix House Academy include biopsychosocial assessments, screening, referral, treatment planning and documentation, case management, family counseling and education, motivational enhancement, psychoeducation, medication management. So you can see there's a lot of components to this program. Just if you want to review it off of our website. So scrolling down, you access child and adolescent services information. So this directly provides services to children and adolescents and addressing the following: drug and alcohol abuse, mental health and behavioral problems, school achievement and attendance, family problems, and criminal behavior. Does the program provide services to parents and caregivers? Looks like it does. What are the recommended parameters? So this is a full day in residential facility, which consists of therapy and group sessions on weekdays in addition to school classes. Family activities are also planned for evenings and weekends. So the recommended duration is 1 month to 1 year, depending on client needs. The delivery setting, you can see it's a residential care facility. If you scroll down, you can see that it does not provide feature homework. The program is also offered in Spanish, and the resources needed to run the program include a residence appropriate to the living needs of adolescents, school and recreational facilities, staff office space, community areas, and group rooms. We continue to scroll down. Looks like minimum provider qualifications. You need to have a master's degree. For the supervisors, for counselors, a bachelor's degree. Community support staff. The education and training requirements, looks like there is a manual and there is training available. What does that look like? The implementation information, that includes pre-implementation assessments, implementation tools, fidelity measures. That's a drop-down, so you can access more information by clicking that drop-down menu. The relevant peer-reviewed research, so this is what I was referencing in terms of making sure that you check out the research that's available for any program that you're interested in, including NRs. That's a drop-down field, and so we provide plain language summaries on the research that we use. The references that are primarily documents that are not factored into the rating. And then finally, the contact information for the program developer. So this is, or whoever oversees the program, implementation of the program. So switching gears to substance abuse treatment. So just highlighting these as an example. So there's more programs in this topic area than what I have listed. So what I did is I identified the programs that are delivered, that can be implemented within residential care facilities or within community agencies or outpatient clinics, because we know that within the community care licensing interim standards, STRTPs can either provide services directly or secured through agreements with other agencies. So those other agencies could be outpatient clinics or community agencies. So these are programs that would be of relevance to STRTPs in terms of addressing substance abuse. I'm not going to go into all of these, but this gives you a sense of what's out there for addressing adolescent substance abuse. Another poll question: to what extent would you consider your system agency trauma informed? So A, very, B, some, C, a little, none, D, none, or E, not applicable. Okay, great. So let's go ahead and broadcast the results. I made it big, but I can't see the results. I'll just look at your screen. All right, looks like most folks indicated some level of trauma-informed care within your agency. That's great. So we're going to go ahead and touch on ways to address trauma using the CEBC. We feel like it's important to first call out the high degree of trauma experienced by children and youth involved in the child welfare system. Research has shown 85% of youth involved in child welfare have experienced at least one potentially traumatic event, and that there are higher rates of PTSD and other mental health problems among these children and youth involved in child welfare compared to the general population. As systems and agencies work to provide services and supports to children and families, it is critical that they recognize their internal policies and practices can also be potentially traumatic as well. So first, we want to call out our trauma treatment topic area. So these are therapeutic clinical interventions. So these are ones that can be implemented within either residential care facilities, community agencies, or outpatient clinics, or either of those settings. So there's quite a bit in this topic area, but this gives you a sense of what's out there, and we're only highlighting the ones and twos. There's 17 programs rated a 3, so definitely a lot to look at. So we also want to touch on the idea of trauma-informed care outside of the clinical interventions that target symptoms, trauma symptoms. We also want to talk about the importance that workers at all levels of an organization are educated on the impact of trauma and how to effectively engage with children, youth, and families without risking re-traumatization. And also know that part of the CCR efforts require resource families and STRTPs to be trained in the effects of trauma. In addition, the interim licensing standards state that services and supports to children and non-minor dependents should be trauma-informed. So that begs the question, how do we become trauma-informed? So in addition to trauma treatments, for individuals, we have trauma treatments at the system level. So this is a topic area that highlights interventions really meant for the service providers and agencies, and that are designed to create a therapeutic environment that is more conducive for clients who have experienced trauma in their families. This topic area includes programs that are designed for the organization to provide trauma-informed care. So these are all the programs that are listed within that topic area, and I've indicated the ones that can be implemented within residential care facilities or community agencies or outpatient clinics. There's only one program that has a rating, and that's the sanctuary model, but we do encourage folks to check out also the programs that are not able to be rated. They do have some research, just not published in, or some of them might have research just not published in peer-reviewed journals. And it's also a good place to start because there are curriculum out there, just whether or not they have research evidence is the question. All right, so moving on to home-based mental health care. Here again is a list of select topic areas that could be relevant to home-based mental health care. So it's quite a bit on here, but I'm only going to be highlighting the disruptive behavior treatments and higher level placements. But you can go into the CEBC website and look at other mental health areas that you might be interested in as well. So disruptive behavior treatments. So these are treatments for youth with a diagnosis of disruptive behavior disorder, including oppositional defiant disorder, conduct disorder, and attention deficit hyperactive disorder, or youth without a diagnosis who are exhibiting similar behaviors. And so these are all programs, or the programs that are listed in front of you are all programs that could be implemented within an adoptive home, a birth family home, or a foster kinship care setting. So there's quite a bit in this topic area. And so we also want to call out some of the therapeutic foster care programs. You might see some of these be repeated. So treatment foster care was also in the disruptive behavior slide that I just looked at. So these are programs that can be really an alternative to an STRTP in terms of meeting the mental health and behavioral health needs of children versus going into a residential setting. They could be implemented in a more home environment. So you can see treatment foster care adolescent is rated a 1. Preschoolers version is rated a 2. The teaching family model, that uses a married couple or other teaching parents to offer a family-like environment in a residence. And then also we have a program called Together Facing the Challenge, which is within our resource parent recruitment topic area. And that is a program that is really like a training consultation approach to improving practices in treatment foster care. So it includes training and consulting for treatment foster care supervisors, as well as training for treatment foster care parents. So again, that's rated a 2. So moving on, resource family support and retention. We have a couple programs in there. So again, Together Facing the Challenge, which we just talked about. And there's other programs that could be used, like Foster Parent College, which is an online program, KEEP, and then the Neighborhood to Family Sibling Foster Care Model. Within the Kinship Caregiver Support Program, the highest level programs, or highest rating programs, are KEEP and support groups for grandparents, caregivers, and children with developmental disabilities and delays. And so that's a program that provides information on financial issues, guardianship, respite care, emotional supports, and problems interacting with multiple social service systems, including accessing health care and educational supports and housing. All right, so moving on to child and family teaming. So these are programs that are within our placement stabilization topic area. We do not have a child and family team topic area specifically, but these are teaming approaches that can be used. But as I mentioned earlier, these are programs that have a very specific outcome, which is placement stabilization, and then I also believe family group decision making is within our reducing racial disparities topic area as well. So these are programs that you might already be familiar with because they are commonly used. But when you're looking at child and family team models, you want to consider what is your outcome what is your desired outcome that you're hoping to achieve, and whether or not these specific programs will help achieve those. So when you look at that, make sure you consider the outcomes. All right, so those are the topic areas that I'm going to highlight in terms of addressing core service areas. We're going to transition to our selection and implementation information that you could access resources. This is a screenshot of that section, and so these are different areas, or these are different buttons that provide different resources. So if you're new to implementation, a great place to start is our implementation guide. So that's a step-by-step walkthrough for selecting and implementing EBPs in child-serving systems. It provides technical assistance materials. It's written in plain language, so it's not complicated, and it provides a great deal of examples, like concrete examples that are relevant to child welfare. So that's available to download. Within our tools and resources, you can download the individual technical assistance materials. There's recorded webinars, implementation measures, and then also we do article summaries on implementation issues, so if you're interested in reading more about the field of implementation. And then we also have implementation examples, including article summaries and recorded webinars from other sources. Our implementation guide and a lot of the materials that we have on our website is guided by the field of implementation science, and there's a specific framework that comes from implementation science called the EPIS framework, and it stands for Exploration, Preparation, Implementation, and Sustainment, and it comes from Dr. Greg Ahrens, who's on our implementation science committee here at the CEBC, and he has helped create this framework to inform social service agencies on some of the considerations on adopting a new evidence-based program or going through a new initiative. And so there are many implementation frameworks out there. This one is specific to the social service field, including child welfare and mental health. So that's why we use the EPIS framework. I'm not going to go into a ton of depth. We have lots of webinars on our website about this framework, but just reviewing it briefly. The exploration phase is when an agency has identified that there is some sort of clinical or service problem and that they want to address the problem either through a new program or through some new initiative. And so once they just make a decision to adopt a new program or a new initiative, they enter the preparation phase, and that's when they start securing the necessary resources to implement the program with fidelity. And then once they start offering the program to clients, they start seeing clients, and they start providing coaching services or after they provided training to the staff and are providing coaching services to the clinicians who are working with the clients, they're entering the implementation phase. And then once they enter the sustainment phase, they're monitoring outcomes, they're looking at fidelity, and providing continuous quality feedback loops. And so those arrows up at the top, those refer to going back to previous phases in order to secure the resources to address any issues within implementation. So this is really a framework to help think through and plan ahead when it comes to implementation, because implementation of evidence-based practices requires a lot more than what folks might normally consider implementation as usual. And so we focus heavily on the exploration phase because we're a dissemination vehicle for evidence-based practices. We're really we really want to make sure agencies take the time to explore whether or not a program is a good fit, not just for their clients, but also for their agency. And so make sure you check out the implementation guide because it's heavily focused on the exploration. So as I mentioned, there's other recorded webinars on our website. You can access those anytime, and those are the links. So you should have a PDF copy of the PowerPoint slides, so you could just click on the links to those and it'll take you directly to them. Okay, so moving on to cross-system collaboration. So this is information that isn't necessarily on our website in terms of discrete programs, but we wanted to provide a review of some of the literature that we found that's been published on what are some of the best practices for cross-system collaboration between child welfare and mental health. So our last poll question that we have is, to what extent does your agency or system engage in collaboration with other service systems? So A, a lot, B, some, C, a little, D, none, or E, not applicable. All right, so we'll give you a second to select the best answer. Okay, so we'll go ahead and broadcast the results. It looks like most of you are somewhat engaged in, oh wait, this is the trauma-informed care question.
Right, but it's the same.
Same responses, okay.
You want to just keep it?
Yeah, we'll just keep it. So it's the majority of you, well, not by much, but somewhat, are engaged in cross-system collaboration, and then a little bit shorter is, well, change in results. We now have very engaged in cross-system collaboration as the #1 response. Okay. Well, thank you. So the reason why we, Continuum of Care Reform is pushing for more cross-system collaboration is, this is vital because some of the research has shown that there are positive gains when systems collaborate. And so what we've been able to identify in the research is that there's positive gains for clients and consumers, and then also for organizations. So for clients and consumers, that includes increased behavioral health utilization, reduced symptomology, greater out-of-home care placement stability, and also decreased differences in service use between white and African American children. And then for organizations, there's greater agency goal attainment, sustained resource linkages, and also more effective and higher quality services. So this is a list of some of the facilitators to successful cross-system collaboration, specifically within that have been identified in research between child welfare and mental health systems. And so the facilitators include enhanced communication, agreement on the outset on the objective, clear roles for each agency involved, conflict resolution skills, institutionalized mechanisms for both planning and problem solving, history of prior collaboration, staying focused on the vision and perseverance to seeing things through, and making sure you're addressing basic differences to create a shared values system, so such as concepts, areas of assessment, perspectives on questions, methods, skills, language, culture. Also involvement of decision makers or liaisons with access to decision makers. Relationship building and interpersonal skills, and then training and cross-training. So these are all the facilitators to successful cross-system collaboration. What are some of the barriers? Well, we've divided barriers into individual and environmental barriers, and not surprisingly, some of the barriers are the opposite of what a facilitator is. So things like poor communication, differences in values, lack of consensus, negative change-resistant staff, competing responsibilities, a preoccupation with the design or the form of the interagency team rather than its function, the loss of autonomy, personality clashes, competition. Environment barriers include lack of resources, ambiguous jurisdictions, overdependence on one agency for the direction, lack of transparency, external regulations, external regulators, lack of design or designated monitors, evaluators, or a review process, lack of specific accountability, siloed interests, and a history of competition between agencies. All right, so finally, I want to touch on a specific cross-system collaboration model that's been used within the research. It's called the Interagency Collaborative Team Model. So the ICT model is designed to enable organizations to work together in ways that generate the structural and processes supports associated with successful implementation and sustainment of innovations, and that includes evidence-based practices. So the ICT implementation process outlines steps designed to lead directly to the kinds of key implementation supports described in the EPIS framework. The model takes its name from the fact that it emphasizes the key role of collaboration among stakeholders and staff members at the systems level for multiple partnering organizations, and of developing or utilizing a local seed team to embody and support promotion and maintenance of the expertise and ongoing fidelity in the practice to be implemented. So interagency collaboration and willingness to share expertise is central to the multiple steps in the implementation process and across organizational levels. Here you can see some of the steps. You can see the citation there if you're interested in learning more about this particular model. But the reason why we're highlighting is to give you a sense of cross-system collaboration between two agencies when it comes to scaling up in evidence-based practice requires a great deal of work and thinking through and planning. So this is one particular model that could help your county with thinking that through and with designing your cross-system collaboration efforts. So that's going to do it for the content portion. We do have some upcoming resources that you can stay tuned for. Our new topic areas that we're going to be launching within the 2017-2018 year includes alternatives to residential placement, resource parent support, and then also visitation. So stay tuned for those. And then we're also currently planning an upcoming webinar on Medicaid billing to support EBPs. So that's tentatively scheduled for September of this year. So if you're interested in staying in the know, make sure you sign up for our email alerts. So you can see the link on your screen there so that you can receive notifications about not just our new topic areas and new programs and webinars, but also any new resources that we put out. And if you have any questions, feel free to reach out to us. There's our direct email. And then we're also on social media, so feel free to follow us on Facebook, LinkedIn, or Twitter if you so desire. So at this point, I'm going to go ahead and review if there's any questions. So I'm going to pause for a second. Okay, so just a couple questions. First, how up to date is the program information on the website? And so that's a good question. So we have periodic reviews for all the programs on our registry. And so we do an annual review for the program information, and then for the research review, it's also annual, or every 2 years.
At least every 2 years. At
least every 2 years. So the ratings can potentially change at least every 2 years. For programs on our website. Second question, does the CEBC offer technical assistance to agencies that want to implement an EBP? So to answer that question, we do, and that's something that we're in the process of launching relatively soon. So we should be announcing that within an e-alert or email alert relatively soon. But the technical assistance that we offer is specific towards agencies that are located within the state of California, and it's primarily phone-based. We can provide some consultation through the phone to agencies that are interested in understanding how they can use the CEBC to meet their needs. And our technical assistance efforts are really geared more towards that exploration phase that I reviewed in the EPIS framework, which is how can you use the CEBC to select a program that's a good fit for your agency and your clients. And we do that through, helping to understand their needs and going through that process very thoroughly. So we don't provide any technical assistance on implementing any specific program. So for that, if you're interested in implementing a very specific program, we encourage organizations to contact the developer, and as I mentioned, you can identify their information on our website. We have a question: how much research has the new diagnosis of complex trauma or development trauma disorder gotten? Yeah, fortunately, I'm not able to answer that question. In terms of
not a program.
Yeah.
It's not something that we would rate.
Mm-hmm. So the diagnosis itself is not a program. So we don't necessarily rate the research behind the diagnosis. We rate discrete programs that would be used to treat a diagnosis. So yeah, I can't really answer that question in terms of how it would apply to the research behind the diagnosis.
But if they have more specific questions, they can contact us at the info@cebc4cw.org email address, and we can provide what assistance we can that way.
Okay. So I hope folks heard that.
Sorry.
That's Jennifer Rolls-Roots. That's our project manager at the CEBC. And if you didn't hear that, basically contact us through our email if you have any questions about research of that nature.
Looks like somebody's typing in one more question.
Well, while they type, I do have another. So how do I get started with choosing an EBP? So that question is really getting at, what's the process? Where do I begin? And going back to, the selection and implementation slides that I reviewed, the guide is a great place to start, our implementation guide, and the materials on the website. But, we understand that, that these materials can only do so much. Sometimes, there's questions, there's you want that face-to-face time, or you want to be able to talk to someone. So, as I mentioned, we are gearing up for our technical assistance. So, make sure you sign up for our email alerts to stay tuned for that, where we'll be announcing, how you can go about, reaching out for more intensive support. Okay, we do have one question. Give me a second while I read it. So we have a question: in your estimation, about how much resources or attention does an agency need to implement or evaluate a new program? So for example, do you suggest a dedicated staff person or range of financial resources to allocate? I think that those are great examples of yes, you do need those things. If you watch those webinars that we have on the implementation guide, really one of the most critical steps to one of the first critical steps to starting the selection and implementation process is forming an implementation team. And these are dedicated folks that are going to oversee the process, who are responsible, and that really drive the selection and implementation process. Because implementation science has shown that you need dedicated people to do that. Otherwise, what ends up happening is there's this diffusion of responsibility and things get forgotten. So with evidence-based practices, you really do need to prioritize the new initiative in order for it to be successful. And some of our previous webinars, specifically Greg Ahrens did one on the role of leadership within an organization. And really one of the key takeaways for me from that webinar was, the role that leadership plays in advocating for that program really predicts the sustainment of the program and how successful that program is. So you do really need to be front-loading a lot of that support for the program even before you get started? So that's a great question. So again, the recorded webinars really get to the heart of implementation in some of these considerations. Great. So yeah, it looks like we're landing right at 11 o'clock. So yeah, we're going to go ahead and wrap up. Again, if folks have questions, feel free to reach out to us. Our email address is on your screen now. And thank you so much for joining today's webinar.
Have a good day, everybody. Thank you.